Hi, it's Dr. Van Duzen, and today I'm going to talk about sinus issues and what you can do to alleviate the symptoms associated with them. Sinus infections and inflammation are typically called sinusitis, and they involve the tissues surrounding the sinuses, which are 8 hollow cavities in your skull. The sinuses are located in the cheekbones, in the forehead, between your eyes, behind the nasal cavity, and there are approximately 37 million Americans who suffer from this. At least one episode each year. Most commonly, people get acute sinusitis, which occurs when fluid blocks the tissues lining the sinuses and often leads to a bacterial infection. So you get cold-like symptoms, you get a runny nose, you get a headache, and these symptoms typically last for up to 4 weeks. Sinusitis can affect people of any age, but typically you find it in people from 18 to 45 years old, and individuals have a higher risk of developing this if they have nasal mucous membrane swelling, drainage duct blockage, narrow drainage ducts because of a structural abnormality, nasal polyps, or other conditions that increase the risk of infection like autoimmune or immune deficiencies. Children also have a possibility of developing this if they're exposed to allergens, other kids with illnesses, pacifiers, or even an environment where there's a lot of secondhand smoke. While acute sinusitis symptoms dissipate after about 4 weeks, people who suffer from chronic sinusitis typically have the symptoms for 8 weeks or longer. And typically they'll have facial congestion, nasal blockages, pus, fever, and nasal discharge. Sounds yummy, right? If you seek treatment for these symptoms, your doctor can perform a nasal endoscope exam, look up into the nasal passages, and that'll determine whether they're nasal polyps, for example, or other structural abnormalities. And you don't want to, if you have chronic sinusitis, you don't want to let it get too bad, because in very extreme conditions you could have bacterial infections and meningitis even. So chiropractic can help possibly with sinus issues with a chiropractic sinus adjustment. So typically we'll do an initial exam, we'll discuss your medical history, do a physical exam, check where the pain mainly occurs, and then the treatments will target the bones and mucous membranes that line the sinus cavities. And in chiropractic, we use our hands to apply pressure and force to the affected areas. And sometimes you can even hear some popping and cracking sounds as we're performing the adjustment. And these sounds are normal, but if you experience excruciating pain, you should obviously let us know immediately. One treatment method is chiropractic adjusting, specific adjusting during this treatment. We'll adjust the joints beyond their normal limitations and correct a possible misalignment that way. It can involve the chiropractor applying a gentle thrust to stimulate the nervous system. This restores function in the affected areas. Also, we may target bones in the facial region or other parts of the body, including the spinal column, depending on the symptoms and location of the sinus pain. Also, there's trigger point therapy. That's another form of chiropractic sinus treatment. Using this technique, we'll apply pressure to a specific trigger point other than the sinus region in the body to relieve pain, although it can also occur in the facial area. We'll target areas around the neck and brainstem to relax and drain the sinus passages of excess fluid, and the buildup of the extra fluid allows the sinuses to develop bacteria, and by eliminating this fluid, letting it drain out, people are often cured of the sinus symptoms. Also, there's light force cranial manipulation or adjusting, and with this chiropractic adjustment method, we'll adjust the skull bones, including bones in the nasal passages, to relieve pressure within the affected sinus areas. And unlike chiropractic, during light force cranial adjusting, the chiropractor will solely focus on the sinuses and bones in the facial area. We'll utilize this method if we discover that your cranial bones are misaligned. And by determining the location of the misalignment and applying a light force and light thrusts, the symptoms could be resolved. Sometimes they may be a little bit uncomfortable, these adjustments, but they really help a lot in helping the sinuses to drain and preventing further complications like bacterial infections and things like that. So anyway, let us know if you have any questions, further questions about this. You can always reach us at newhopechiropractic.com. Shoot me an email, and again, we'll be more than happy to do some complimentary evaluations, complimentary consultation, that is, to see if chiropractic's a good fit for you. Have a great day.